Hi, I'm Tatiana the doula, and I'm here to go over the lactation counselor training course notes for section 4B. So this packet is the eighth packet of 9 packets, and this is going to be a little bit long. There are 10 or 11 pages in this particular packet of notes. So I'm going to get right to it. So, lactation counselor training course notes 4B. Premature babies, late term 34 to 36 in 6 and 7 weeks, and early term 37 to 38 in 6 and 7 weeks infants, as well as others, may struggle with breastfeeding. They need many opportunities at the breast to develop the skill of latching and transferring milk. Immature babies are commonly less alert, have less stamina, and have greater difficulty with latching, sucking vigorously, and transferring milk. ABM number 10. What about the NICU? Can breast milk improve outcomes and save money? For every increase in human milk of 10 milliliters a day, the odds of sepsis decrease by 19%. For a 2-pound baby, that translates to 9 millimeters of human milk a day. For a 4-pound baby, that translates to 18 milliliters a day. Preemies do better on human milk. Predominant breast milk feeding in the first 28 days was associated with greater nuclear gray matter volume at term equivalent age. 28 to 32 weeks gestation infants in NY NICU, infants fed breast milk. I'm sorry, this is a quote. Infants fed breast milk have faster brainstem maturation compared with infants fed preemie formulas. Exclusive breast milk feeding is associated with more rapid maturation and intestinal barrier function. Extremely premature infants who received an exclusive human milk diet had significantly lower odds of incidence of NEC and mortality. Human milk diet of more than 98%, NEC rate of 1.3%. Preterm formula net NEC rate 11.1%. Mixed 8.2%. Breast milk and the very low birth weight baby. For every 10 milliliter increase in breast milk ingested, there was an increase in the Bailey. Okay, I put here there was an increase in, and then the quote isn't finished. So I don't know what that's about. The Bailey Mental Development Index, the Bailey Psychomotor Development Index, and the Behavior Rating Scale. There was a 6% decrease in rehospitalization. Birth weight and length of stay are not associated with breastfeeding behaviors. Preterm babies at the breast have better suck-swallow coordination and oxygenation, including resting energy expenditure after feeding, than when bottle feeding. Guidelines for the initiation of breastfeeding in preterm infants should be based on cardiorespiratory stability, irrespective of current maturity, age, or weight. What other interventions help mothers of preemies? Neonatologist encouragement during prenatal meeting to feed human milk. PIBS individual aspects include rooting, areolar grasp, latched on, sucking, longest sucking burst, swallowing. Babies who have Down syndrome often struggle with the skill of breastfeeding. Low tone cues, depressed reflexes, hard to latch on, gape, hypotonic perioral muscles, weak suck, enough to decrease mother's milk supply, piston ration sustain. Deficiency in the smooth tongue movement, skeletal abnormalities of the mouth and skull will decrease volume of the oral cavity. Significant improved development in the sucking behavior over time is possible. Helpful corrective interventions for positioning babies with difficulty sustaining a feed. Individualized positions. Hold baby to assure maximum tone. Provide sensory input to the mouth and muscle toning exercises if appropriate. Individualized handhold to connect the baby and breast. Longer duration of feeding with breast milk lowered the incidence of otitis media in babies with clefts. For babies with clefts in the lip and palate, making a seal, creating a vacuum, and sustaining the feed is the challenge. Guiding principles. Milk removal is needed in order to make milk. Expression within 1 hour of birth with the highest milk volume had the most milk. Hand expressed milk was highest in calories compared to pump milk. Early hand expression with later addition of pump expression yielded milk that exceeded norms for fat and energy. Using a pump or hand expression to build the milk supply. Ongoing support person and professional oversight. Expressed in proximity to the infant, particularly during kangaroo mother care for higher milk volume. Double stimulation. Collecting milk on one breast when nursing on the other is an effective strategy. Guided imagery has been shown to increase the amount collected via breast pump. Power pumping for a day or two may also help to increase volume. Adequate frequency of stimulation plus try 5 minutes, pause 5 minutes, pause 5 minutes. Adequate frequency of stimulation plus try 5 minutes, pause, 5 minutes, pause, 5 minutes, pause. What about galactagogues? Substances believed to increase milk production. Some providers may inappropriately recommend galactagogues before emphasizing the primary means of increasing milk synthesis or evaluating other medical factors that may potentially be involved. ABM number 9. Prescribing drugs and herbal remedies is not within the scope of practice of any LCPs unless they are legally prescribers. Herbs can have pharmacological properties and significant side effects. Recommending herbs is prescribing. Lawrence & Lawrence gives a list of herbs that are considered safe for tea drinking. What about fenugreek? May cause reduced absorption of all medications used concurrently. Worsening of asthma, diarrhea, maple-smelling urine, and perspiration. Cross-reaction is possible if there is an allergy to chickpeas, peanuts, and other legumes. Concerns about a decrease in blood coagulation and decreased serum glucose. After 21 days of taking fenugreek or a placebo, there was no statistical difference in prolactin levels or milk volume. Systematic review of the efficacy of herbal galactagogues. Given the insufficiency of evidence from these trials, no recommendation is made for the use of herbs as galactagogues. How about Reglan? Metoclopramide to increase milk supply. Off-list use. Research shows that Reglan did not improve breast milk volume or duration of breastfeeding in mothers pumping for preemies. What about domperidone to increase milk volume? Cochrane. Domperidone did not show improvement in longer-term outcomes of breastfeeding. Improvement of breastfeeding practices seems to be more effective and safer than the use of an off-label domperidone treatment. Domperidone is not currently a legally marketed drug or approved for sale in the U.S. Some galactagogues do increase serum prolactin levels. However, no direct correlation has been demonstrated between artificially increasing baseline serum prolactin levels and long-term breastfeeding success. Conclusion. If mothers are provided education and practice techniques that support lactation physiology, galactagogues appear to have little or no added benefit. Is relactation possible? Relactation follows pregnancy, not necessarily breastfeeding. Relactation variables. Ability to produce milk, baby's willingness to nurse, length of time it will take to produce milk. It's not easy. It's not easy. Interviews with participants in Montana reveal feelings of rejection, anger, stress, and failure. Relactation is a good strategy for emergencies. It is possible, including for transgender women. Requires a lot of time and effort. Almost never results in a full milk supply. Works best when the focus is on the experience and the relationship rather than on the amount of milk from the mother and the baby's diet. Rather than looking for a magic bullet to increase milk, we should assess all aspects of the comprehensive risk assessment tool, how often the baby is being fed and what is being fed, whether there is milk expression, how effective feeding or expressing is, how much milk is being transferred at the breast, Observe at least one feeding with pre and post weight checks. How much milk the baby needs versus how much it is getting. Need for comprehensive pediatric and maternal medical evaluation. Guiding principles. Milk removal is needed in order to make milk. Number 2, infant requires nourishment to remove milk. When thinking about a supplemental feeding device, consider cost and availability of the device, ease of use and cleaning of the device, stress to the infant of feeding method, whether milk volume can be fed in 20 to 30 minutes. Whether anticipated use of the plan is short or long term, family preference, expertise of the healthcare staff to teach or supervise the plan, whether the method enhances development of breastfeeding skills, safety and efficacy of device use, consideration of parents' ability to use device safely, issues to consider when and if using bottles. Healthy babies fed at the breast only are the most likely to be breastfeeding at 6 months. Breastfeeding support should be offered in the NICU before using bottles. Babies who are bottle-fed babies with either formula or express milk are 2 times more likely to empty the cup or bottle in late infancy than those who are fed only directly at the breast. Bottle feeding may alter self-regulation of intake, contributing to later obesity, higher weight gain, velocity, and BMI. Bottle size may be a modifiable risk factor. Cup feeding for preemies. Cup feeding results in less increase in heart rate, better oxygenation, ability for infant to pace own feeding. Preemies randomized to cup feeds versus bottle were significantly more likely to be fully breastfed on discharge home. 2 Cochrane reviews agree. Cup feeding is the preferred supplementation method of the WHO and UNICEF, inexpensive to implement. However, regardless of method, cup or bottle, supplementation has a detrimental effect on breastfeeding duration. The number of supplements makes a difference. More supplements, less duration. Guiding principles. Milk removal is needed in order to make milk. Infant requires nourishment to remove milk. Above all, the infant cannot be compromised. Separation due to work or school. What can we do to support parents who are separated from their babies because of work or school? Get tuned into reality for this family. Re-examine our individual point of view. Focus on helping with breastfeeding in the first week after discharge. Assure support 2 to 3 weeks before return to school or work or school and continuing through adjustment. Tips from Office on Women's Health. Make support for parents available in the workplace or school. Working plans. Expecting to work in the first year after baby's birth does not significantly impact whether or not breastfeeding is initiated. Planning to go to work may negatively influence the intention to exclusively breastfeed. Timing of returning to work and ending breastfeeding are closely linked. Returning to work full-time before 3 months may reduce a mother's ability to meet her intention to breastfeed by at least 3 months. 2010 healthcare reform, ACA, created a workplace breastfeeding law. This amendment to Section 7 of Fair Labor Standards Act requires employers to provide reasonable break time for an hourly employee to express breast milk for her nursing child for 1 year after the child's birth each time such an employee has the need to express the milk. The space must be a private place other than a bathroom and is shielded from view and free from intrusion by coworkers and the public. Only 4% of employed women with infants had access to both break time and a private space to express breast milk. Resources for making breastfeeding friendly workplaces. Break time for nursing mothers from U.S. Department of Labor. Business case for breastfeeding from HRSA.gov for employers, and for employees. Investing in workplace breastfeeding programs and policies. http businessgrouphealth.org. Company-sponsored lactation programs can enable parents to provide breast milk for their infants as long as they wish, even those who are the least likely to choose breastfeeding. According to the IFPS-2, 35% of pregnant women said their workplace was very supportive of breastfeeding, but 52% of postpartum women said their workplace was very supportive. Only about half of women working in U.S. are covered by the Family Medical Leave Act. What about staying home with the new baby? Oh, actually, sorry. This is another, the way the notes are, they're a little confusing. This is a subsection called Leave Act. What about staying home with the baby? Paid maternity leave could improve exclusive breastfeeding rate at 6 months. Fewer than 10% of Americans surveyed disagreed that the U.S. should have paid maternity leave. Achieving a healthy inter-pregnancy interval. The World Health Organization recommends, after a live birth, the recommended interval before attempting the next pregnancy is at least 24 months in order to reduce the risk of adverse maternal, perinatal, and infant outcomes. Which child spacing methods are appropriate for breastfeeding? Contraceptive counseling during breastfeeding extends beyond issues of efficacy because the selected method must be appropriate for a woman's breastfeeding expectations. ABM Protocol Number 13. Lactation amenorrhea method asks 3 questions. Is the baby younger than 6 months? Is there food or suckling except at the breast? Has menses returned? Return of menstruation. Difficult to predict timing. Ovulation first. Decreased supply. What about other forms of birth? Women using combined oral contraceptives versus progesterone only were least likely to continue breastfeeding for 4 months. Women using contraceptive hormones were slightly more likely to report concerns about milk supply, especially around the time of starting them. Barrier and natural family planning methods are all considered okay. IUDs are considered okay. Progestin-only forms of hormonal birth control are considered okay when breastfeeding, but when to start is controversial. IUDs, some have hormones, can be placed in the postpartum without affecting breastfeeding outcomes. Pills, oral contraceptives. What about the altering the diet to prevent allergies to the baby? The most important modifiable risk factors for child allergy are maternal smoking, a type of infant feeding, cesarean birth. It may even be that the consumption of allergenic foods in pregnancy reduces allergy and asthma in children. What about other foods eaten when breastfeeding? Cow's milk whey is the only substance consistently shown to bother some babies with colic symptoms. Not all babies show symptoms, and those that are bothered do so on very different amounts of liquid cow's milk, from 4 milliliters to 400 milliliters. Proctocolitis, rectal bleeding, may occur even in exclusively breastfed infants. Cow's milk protein allergy may play a role in pathogenesis, many of the cases of proctocolitis. Sometimes sensitization is through hidden bottle practices. A hidden bottle practice is when like a relative is sneaking a bottle when you're exclusively breastfeeding. That's one example. Standard treatment for proctocolitis is the exclusion of the offending protein from the mother's diet, usually cow's milk, although soy, corn, egg, and chocolate has also been implicated. Many, 50%, have a multiple positivity. Resolution of visible rectal bleeding took place within 72 to 96 hours in most babies, although one took a week. Supporting calcium needs. Women on milk-free diets should be referred for dietetic counseling. Dairy products have nutrient value other than calcium, protein, vitamin D, etc. Pregnancy and lactation are not the same. Fetal calcium demand is met by increased intestinal absorption during pregnancy. Regardless of the amount of calcium in the diet, breast milk calcium is met by renal calcium conservation and loss of bone, which is recovered post-lactation. There was a 3% to 9% decrease in bone density during lactation. Breastfeeders, even on high calcium diets, lost 3.9% BMD in lumbar spine, but gained 5.5% after weaning. I'm trying to see bone density. I think BMD is the bone density. Pregnancy with breastfeeding in adolescents did not negatively affect BMD at later age. Estrogen levels increased during weaning. The way bone mineralization increases in adolescent girls as estrogen levels increase. This is another example of the body adapting physiologically and positively to lactation. You shouldn't eat spicy foods when breastfeeding. That's a quote. Many anthropologists believe that flavors of the culture are conveyed to the child through milk while lactating. Children are acculturated to the taste of their native foods through breast milk. Longer duration of breastfeeding is associated with higher food variety at 3 years. Foods that do not taste familiar are more likely to be refused. Caffeine. Caffeine habit does not relate directly to amount of caffeine in her milk. Caffeine may accumulate in premature and very newborn infants. Caffeine consumption during pregnancy and while nursing has no consequence on infant sleep. Coffee consumption is not associated with the duration of exclusive breastfeeding. Alcohol. When research participants were studied after drinking a 0.4 kilogram dose of alcohol in orange juice, oxytocin levels significantly decreased, but prolactin levels increased. In another study, alcohol completely blocked the release of oxytocin. Babies may not like the taste. Alcohol is water soluble. It passes in and out of the milk as her blood alcohol increases, then decreases. There should be a period here. Or a colon. It is not trapped in milk. Pumping and dumping will not remove alcohol. I highlighted that. Pumping and dumping will not remove alcohol. Another counseling issue is about the safety of the baby if the parents are inebriated or incapacitated. The Institute of Medicine says about breastfeeding mothers, if alcohol is used, advise the lactating woman to limit her intake to no more than 0.5 grams of alcohol per kilogram of maternal body weight per day. For a 132-pound woman, 0.5 grams of alcohol per kilogram of body weight corresponds to approximately 2 to 2.5 ounces of liquor, 8 ounces of table wine, or 2 cans of beer. Low-level drinking during breastfeeding is not linked to shorter breastfeeding duration or adverse outcomes up to 12 months of age. Questions remain about the effect on the infant when the mother combines smoking and drinking, especially binge drinking. Consuming alcohol in excess of 2 standard drinks per day during lactation was found to be independently associated with shorter breastfeeding duration, even after consideration of previously identified predictors of breastfeeding duration. Breast milk is often studied to understand population to environmental contaminants exposure because it is easily accessible and rich in fats. I'm going to repeat that. Breast milk is often studied to understand population to environmental contaminants exposure because it is easily accessible and rich in fats. Scary headlines arise from reports of new findings. There may be specific populations at risk, generally agricultural or occupational. Toxic exposure to the infant occurs largely in utero and minimally through milk. Breastfeeding should be universally encouraged and the environment should be cleaned up. So basically, don't stop breastfeeding because the environment is bad. So that concludes the notes for section 4B. Thanks for listening.